Good morning, everybody. I'll give everyone a minute to join. All right, I think we can get started. It looks like we've got quite a few people that have joined. So first, good morning, everybody, and welcome to our first webinar of the Women Veterans Empowerment webinar series. Today, we will be discussing the facts and myths of COVID-19. Our speakers are from the Paralyzed Veterans of America Medical Services Department. We have Amanda Millicent, the Director of Medical Services, and Caitlin Johnson, the Associate Director of Medical Services. Please go ahead and feel free to use the Q&A box to ask questions while we have the webinar today. At the end, you can use the raise your hand feature to raise your hand, and we will call on people and unmute you so that you can ask your questions. If you have any technical difficulties during the webinar, please use the chat box to let us know. And with that, I will turn it over to begin the presentation. Thank you.
Thank you, Marissa. Good morning, everyone. My name is Amanda Millicent. As Marissa said, I work with PVA Medical Services. I'm a registered nurse. On this call, I will have Caitlin Johnson, my team member, assisting me with the presentation, and we have two of our other staff nurses, Rebecca Coffin and Sarah Abebe, who will also be helping us answer some of your questions in the chat box. So please feel free to comment and question throughout the presentation, and we'll try to get to as many of those as we can at the end. So COVID-19, what is COVID-19? Now, you all know that the government loves acronyms, so COVID-19 has to stand for something, right? COVID actually stands for, the CO stands for corona, the VI stands for virus, and the D stands for disease. 19 is attached to it because it was first found in 2019. It's a novel coronavirus. There have been many different coronaviruses out there, and you are probably most familiar with one that is the common cold. Now, COVID-19 is much more severe than the common cold. COVID-19 is also named as the SARS-CoV-2, and back in 2002, there was a SARS outbreak that many of you probably can remember. That was also first identified in China. SARS stands for Severe Acute Respiratory Syndrome, meaning that, as what it states, that it's a severe illness to our pulmonary system. Now, the COVID-19 has not been previously seen in humans. Unfortunately, there's not a cure at this time. There's a lot of research being done to understand the virus and how it affects people of different sexes, different age ranges, different populations, different geographic locations. So much needs to be learned at this time. As I mentioned, this was also identified first in Wuhan, China, and it has not been confirmed whether this was a man-made virus or if it was, if it came from animals. So it's still to be determined. Unfortunately, there are stigmas for COVID-19, and stigmas are when somebody sees somebody in a negative way. And unfortunately, there are people that are dealing with stigmas of COVID-19, and some groups of people who may be experiencing stigma from COVID-19 are people that have traveled internationally, emergency responders and healthcare professionals. How unfortunate is it that we have frontline healthcare responders and workers that are helping to help those that are fighting this illness who are being stigmatized. They're putting their lives on the line, and they're still being looked at in a negative way. People that are of Asian descent are being stigmatized because they are unfortunately being blamed for the virus because it came out, it was first identified in China. It is not their fault. Stigmas can lead to social avoidance, rejection, and violence. So I encourage you all to not join in associating stigmas to people because it can really affect their mental well-being. And that's something that we really don't want. We want to make sure that everyone is as healthy as possible throughout this time. So I'll hand it over to Caitlin.
Good morning, everybody. I'm Caitlin Johnson. So I'm one of the Associate Directors of Medical Services with PVA. So we're going to kind of go through some of the biggest myths that are out there and just provide a little bit of clarification and clarity on what those myths are and what the truth is behind them. So one thing that is very commonly shared is that this new novel coronavirus only impacts elderly people or children. And that is not the case. So it is true that elderly people do have a higher mortality rate from the coronavirus, but it is not true that it only impacts them. We see younger people who contract the disease and have poor outcomes. Children do not tend to be as impacted. So if anybody is younger than 20, we don't see very much mortality among that age category. The highest mortality rates are among people who are 65 and older, and they do tend to have comorbidities, but anybody can contract the illness and anybody can become critically ill from this. So it's important that we recognize that and maintain all of the precautions, no matter our age category or our health background. So all of those things that the CDC recommends, hand washing, social distancing, face masks, and we'll talk more about that later as well. So the other big thing that is out there about the new coronavirus is that it is just like the flu and it's nothing to worry about. Well, two things. The flu is very serious and does carry with it a pretty high mortality rate as well, especially for elderly people and children. But this COVID-19 has been shown to be much more contagious than the flu. It is much more deadly than the flu, and the signs and symptoms of it are not as consistent across the board. So it can be difficult to identify what COVID-19 is in somebody versus the flu. So the flu symptoms tend to be pretty consistent, whereas there's a lot of variation in what COVID-19 can look like in somebody who is sick from the disease. Amanda?
Some facts about symptoms. So symptoms appear typically 2 to 14 days after exposure to the virus. Imagine if you were exposed to somebody who was infected and you were going about resuming your life normally, and how many people do you think that you would come in contact within 14 days? And how many of those people would become infected? It's, as Caitlin said, it's very contagious. That's why the CDC has been strongly recommending that we use personal protective equipment, and they're emphasizing using hand hygiene strategies to make sure that we're as safe as possible. The CDC initially recognized just 3 symptoms for COVID-19. So many people were feeling ill, not having fever, cough, or shortness of breath, and they thought that they were fine. So then this, of course, would increase the virus being spread to more and more people because those individuals did not think that they had COVID-19. So the CDC recently added 6 new symptoms to the COVID-19 symptom list, and they are chills, repeated shaking with chills, muscle pain, new loss of taste or smell, headache, and sore throat. This list is not all inclusive. There are other symptoms that are atypical of COVID-19. Some may have dizziness, some may have experienced a new rash. Older adults typically tend to have atypical symptoms, and older people respond differently, oftentimes to different illnesses. And older people and those with spinal cord injury and multiple sclerosis have altered thermoregulation, so their temperature may not be elevated, but they still may be feeling ill and may be infectious. So if you're not feeling well, please contact your primary care provider. I would like to have Marissa deploy a poll question, and I would love to ask for all of you to respond to this question. The question is, I was in a grocery store near someone that was coughing. Should I be tested for COVID-19? Yes, no, or unsure? I'll repeat the question. I was in a grocery store near someone that was coughing. Should I be tested for COVID-19? I will end the poll. Okay, so great. 76% of you said that no, you should not be tested. 5% said yes, and 19% unsure. So you should not be tested if you was near someone that was coughing, because you don't know if that person was infected with COVID-19 or currently infected with COVID-19. Also, you still may not be able to get the virus, but I would recommend that you just increase your awareness of you possibly feeling ill, continue to use safe practices with hand hygiene and just covering your face as much as you can when you're out in public. But if you begin to experience symptoms of COVID-19, you do need to notify your provider, and you may get tested depending on what your provider says.
Okay, so some myths around some of the symptoms with COVID-19. If I get COVID-19, I will know it. There's actually a lot of people who have what's called asymptomatic cases of COVID-19, which means that they present with no signs or symptoms. They just contract the virus. Their body is able to create antibodies for it, or already has seen something similar enough that they have antibodies that can attack it. They do not have symptoms, or if they have symptoms, they're so mild that they don't notice them enough to pay attention and believe that they're sick. And then they will just recover from it. And then some people, have it ranges all the way from that to people in the ICU on ventilators. So we do not necessarily know if we have the disease. But if you do not have signs or symptoms, again, you do not need to be tested. But if you are worried or concerned for any reason, you should always contact your primary care provider and discuss what you are concerned about with them. And then if I'm not feeling well and my symptoms do not align with the CDC's COVID-19 list of symptoms, I do not have COVID-19. Again, the list of symptoms that Amanda just reviewed is not all inclusive. Some people even present with stomach issues, so they'll have nausea and vomiting. Some people just have headaches. There have been issues with people having like symptoms in their feet. And so the symptomatology is very wide and varied. So we don't necessarily know that what the conclusive list of the symptoms looks like. Again, if you have any concerns, contact your primary care provider, discuss those concerns with them, and see what they recommend as far as testing.
So transmission and protection. Now this is spread from person to person through respiratory droplets, and it's typically when an infected person coughs or sneezes and we come in contact with those infectious droplets. So if we're near somebody who is infectious with COVID-19 and maybe we're walking past that person and we're within 1 to 2 feet from them, or even a little more, and that person coughs or sneezes, those droplets can land on our face, our mouth, our nose, and then enter our system, and then we could potentially become infected with COVID-19. That's why it's important to make sure that you're protecting yourself as much as possible from this. And also it can be transmitted by touching contaminated surfaces. That's why hand hygiene is so important, even for individuals that are infected with COVID-19, because as they're touching their face, their mouth, they're getting those droplets onto their hands, and then they're touching the toilet flusher, the doorknobs, cell phones, remote controls. So it's very important. I cannot emphasize this enough to continue to practice safe hand hygiene and cleaning surfaces often. Marissa, I would like to deploy the poll question number 2, please. So the question is, wearing a cloth face covering or mask will keep me safe if I am around anyone who has COVID-19. True, false, or unsure? Give it a couple more seconds. All right, and we'll end the poll. So most respondents, 48% said false. They, that the face covering or mask will not keep them safe, 26% unsure, and 26% true. There's not enough information out there just yet, but wearing a face covering or mask will not protect anyone 100% of the time from acquiring COVID-19, but it is recommended to have some sort of face covering or mask whenever you're out in public and around other people. So protection, make sure you're practicing social distancing. The recommendation is to stay right now at least 3 to 6 feet away from people, preferably 6 feet, so that those respiratory droplets from infected individuals, they can't travel more than 6 feet, or it's not as likely for them to travel more than 6 feet. Face mask. As I mentioned, there's not one mask that will ensure complete protection from COVID-19. Now, many of our members have been asking about N95 masks. N95 masks are very effective in filtering airborne particles. They block 95% of small particles if they're properly fitted. Most people, the general public, is not going to be fitted for an N95 mask. It's just something that doesn't happen. Healthcare workers, first responders, those are types of people who are fitted properly for an N95 whenever they start their employment, in the event that they may need to wear an N95 to protect themselves from getting ill from patients or people that they are caring for. There's not enough data out there to say that a cloth mask, to see how effective it is. There are some talks out there that if you wear a face cloth mask that you could still be infected with COVID-19, but I believe that it may provide some level of protection, just depending on how many layers of fabric and what type of fabric is used in the mask. And you want to make sure that you're developing and maintaining a healthy lifestyle. because when we're stressed out, stress suppresses our immune system. And when that happens, it's easier for us to get sick. So we want to make sure that we're incorporating healthy habits into our daily lives, such as maybe some light exercise, moderate exercise, drinking enough water. You can do some good yoga, good stretches, deep breathing, meditation, journaling. Those are all ways to help reduce stress and maintain a healthy lifestyle.
Okay, so protection myths. I'm sure that anybody who has gone out has seen people going into public places wearing latex gloves or disposable gloves. So the CDC does not recommend that people wear disposable gloves in public places. Part of the reason for this is that people, when they wear disposable gloves, they do not tend to engage in good hand hygiene. And all of the research that we have right now shows that the most important part of preventing the spread is the social distancing and hand hygiene. So making sure that we are participating in really good hand hygiene is far more important. And discouraging people from wearing disposable gloves in public places helps to ensure that they are participating in good hand hygiene. So disposable gloves in public places is not recommended. Any face mask is effective in preventing the spread of COVID-19, or also known as SARS-CoV-2. So if a face mask is not covering the nose and mouth, it is not going to be effective. It must cover both your nose and your mouth. I'm sure you guys have seen people walking around with their noses exposed. It is important that people wear it over their nose and mouth, and that is a snug fit around the face. All people should wear face masks. So the CDC does not recommend anybody who has any issue with difficulty breathing. So some people who might require oxygen or have asthma conditions that are easily triggered or have any kind of scar tissue in their lungs, the CDC does not recommend that those people wear face masks. They also don't recommend that anybody under 2 years old wear a face mask. And that might be a little bit young, so it could potentially be a little older than that if you have a child who would tend to touch their face a lot or would pull the mask down or touch their face and then touch surfaces. And then anybody who cannot remove a face mask on their own should also be discouraged from wearing a face mask. So that would include anybody who has an altered level of consciousness for any reason, or anybody who is unable to use their hands with dexterity to put on or off the mask. And next slide.
Would you like to deploy the poll question?
Oh, yes. So it is unnecessary to wash my hands or use hand sanitizer if I wear disposable gloves. And actually, Amanda, I can't see when the results are in, so if you could review that.
Sure. And we'll end the poll. So 96% of the respondents said false, 4% said true, and 0% unsure.
So we must continue to use good hand hygiene, which includes using hand sanitizers and washing hands no matter what. So if you do choose to use disposable gloves, you still must participate in good hand hygiene to protect yourself and others, no matter what. Okay, so transmission myths, slide number 2. I'm not really sure where this came from, but I have seen this all over the internet, that coronavirus can be spread through the new 5G cell signals. I'm sure you guys know this, but that is completely untrue. Viruses do not spread through cell phone signals. The main form of transmission, again, is through those infected respiratory droplets or people touching surfaces that have those droplets and then touching their faces. So no transmission through cell signals. And then This one is a big one. So if you get COVID-19, you will die. That is not true. Most people survive COVID-19. So when we are comparing the mortality rates with the flu, I put that data in here. You see it does have a higher mortality rate than the flu, but still out of every 1,000 people who contract the virus, between 6 and 7 may die from the disease with the data that we have right now. So most people do survive COVID-19. And even people who have underlying conditions and are elderly or are sick with, sick with other things, even those people are surviving. So we do not want anybody to think that if you get the COVID-19, you will die.
All right, disinfectants and cleaners. This has been a hot topic in the news over the last few weeks. So bleach, Lysol, and disinfectant wipes and other household cleaners have been proven to kill the novel coronavirus. And make sure that you're using cleaning products as directed on the packaging. Do not use more than what you should be, and just be very careful. Make sure that you're wearing gloves so that you're not burning your skin. We know that some people are drinking disinfectants and dying from this and experiencing severe medical complications from it. This can really, as I mentioned, damage your skin, damage your mucosa and other organs. So please make sure that you use cleaning products as directed on packaging.
So one thing that was being reported is that you want to use heavier concentrations of cleaners like bleach in order to kill the virus. That is not true. So you should only ever use cleaners as directed on the packaging. So we have seen that there's been an uptick in the number of people who have called in to poison control. Mostly from exposure to cleaners like bleach and Lysol. And a lot of that is around them trying to increase the concentration to kill the virus more effectively. In the concentrations that are recommended on the packaging, it is effective for killing the virus. So there's no need to increase the concentration. And again, never use cleaners such as bleach on your skin. There are reports that you should be gargling bleach in order to protect yourself, that you should spray it on yourself, you should bathe in it. None of that is recommended. Do not ever use it on your skin, and be sure that you are following the directions on the packaging. And if you do come in contact with something in a way that makes you think that you could get sick from it, definitely call poison control immediately.
Please deploy the poll question. Is it safe to mix household cleaners to improve their ability to kill COVID-19? True, false, or unsure? We wait a few more seconds. Now end the poll. 92% of respondents said false, 4% said true, and 4% said unsure. So that's right, you should never mix household cleaners to improve their ability to kill COVID-19. As we mentioned, make sure that you're using the cleaner as instructed on the package. This could potentially cause a big problem mixing chemicals. It may be, who knows what type of chemical reaction may come about from mixing different chemicals. So please make sure that you're not mixing household cleaners.
Poison control has mentioned that there is has been an uptick in people who are mixing bleach and ammonia specifically. And bleach and ammonia creates a toxic fume that that actually can be deadly. So be very, very careful and very sure that you are following the directions on the labels of the packaging, and never mixing any chemicals.
Some facts about testing. Diagnostic testing has been what people have been, this PCR test, it stands for polymerase chain reaction. And what it does, it detects DNA from any organism. So this is the test that is out there to test individuals to see if they have COVID-19. And it's through a mucus specimen. There's also the antibody test. A lot of people have been asking us about this test and when it's most appropriate. It is a blood test, and it identifies people that have been previously affected with COVID-19. And many people feel that if they get an antibody test and learn that their test was positive and they had COVID-19 in the past, whether it was a few weeks ago or a couple months ago, that they're okay, that they think this is a one and done type of deal, and that they no longer need to protect themselves or others from COVID-19 because they feel that they've built up enough antibodies that protect them if they were to be exposed from COVID-19. This is not true. There's not enough data out there yet to prove this. Antibody testing is really helpful for researchers in the field that are trying to understand how many people have been infected with COVID-19 and to do some further research studies for that. So it's also helpful for employees who may be essential, and maybe they were positive and down the road they get an antibody test, and that test, if an individual is tested and they know that they've had it, then that they can go back to work. But I just don't see it being very effective just for the general public at this time. Marissa, can you please deploy the poll question? So if your antibody test result shows you had COVID-19 in the past, you do not have to adhere to social distancing guidelines. True, false, or unsure? Oh, and the poll. Great, everyone was listening. 100% of you said false. If you have had a positive antibody test that shows you've had COVID-19 in the past, you still need to adhere to social distancing guidelines. Next slide.
Okay, so some myths around testing. If you test negative today, that does not mean that you will never contract the disease or test positive. So testing negative one time does not mean that you are protected from COVID-19. I'm getting an echo. It is important that we are vigilant even after a negative test for adherence to all of those guidelines that the CDC put out. So social distancing, hand washing, face masks. And if you do develop signs or symptoms of COVID-19 in the future, even following a negative test, you contact your physician and get retested. And then I can test myself at home for COVID-19 with a home test kit. So at this time, the FDA has not approved any testing, antibody testing or virus testing. So an active infection test at home for COVID-19. So in order to have accurate testing done, you need to contact your physician and coordinate with them to go to a testing center for antibodies and disease detection.
Now, what you all have been waiting for, how women are impacted. So I was doing some research and found that there's been some initial research about 10 years ago that showed that there are gender-related the gender-related immune response shows that women typically clear infectious viruses better than men. So that's a success for us. But it doesn't mean that that we still need to not adhere to social distancing guidelines. Don't think that, hey, I'm a woman, if I get COVID-19, it won't be that bad. We have no idea how this affects everyone. This is just from some general research pre-COVID-19. They're extrapolating this to just to kind of connect the dots and say that it may be the same for COVID-19, but it's still too early to determine that. As far as pregnancy, yes, women can still become pregnant if they're exposed to COVID-19. There haven't been any cases yet where it shows that the mother could pass COVID-19 to her baby. Hopefully that does not happen. Pregnant women are at higher risk for some infections, so it's unknown if they are at higher risk for COVID-19, but it's just something to be mindful of. You may not be pregnant or may not be of childbearing age, but it's just good to know this. So if that you do know other women who may be pregnant or planning on having a family, this would be a good conversation to have with them. And during pregnancy, the pregnant mother should avoid others who have been exposed to the virus and those that are ill, because we want to make sure that the mom does not become infected. Breastfeeding, there have not been data yet on breastfeeding, how that affects infected mothers. But as of now, the recommendations are for pregnant moms who are breastfeeding to wash their hands before they start breastfeeding, to wear a face mask when breastfeeding, and then making sure that the mom washes all the equipment properly before and after breastfeeding. Some burdens for women. I know gender roles have been changing this last decade, that men have been stepping up some more, as some research has showed, but women still tend to carry additional burden. So women may be at home with their children, may be homeschooled now, and they may have to deal with that, and maybe deal with any chronic medical conditions that they're experiencing. They may have to also be working from home as well, and managing all that could be a bit overburdened for many people. So we encourage women and all people to incorporate healthy lifestyle, just so that we can make sure that we're not getting too stressed out, because we don't want to get sick.
Okay, so some myths around this. Women are at higher risk for contracting coronavirus. That has not been shown in any of the research at this time. At this time, it is believed that the chances of contracting the coronavirus are the same for men and women. But in the long-term view, men tend to have worse health outcomes than women do, meaning that they tend to have more severe illness when they do contract coronavirus. Pregnant women are at higher risk for contracting coronavirus. That has not been shown in the research either. So at this time, it is not believed that pregnant women are at any higher risk than anyone else for contracting the disease or having serious disease related to contracting the virus. It's also too early to rule out that the mother could pass the virus to their baby in utero, but there has been some early research that suggests that this is not happening. Most viruses do not pass to babies in utero, and it looks like that is true for COVID-19. And then it is not safe to breastfeed if you have coronavirus. At this time, there's no evidence to show that coronavirus is found in the breast milk of nursing mothers. The way that you would pass it seems to be from those respiratory droplets, so from breathing on the baby or coughing on the baby, but it is not passed through the breast milk.
So what is the future of COVID-19? These are some topics to think about. Some of these topics are in the news, but we don't really know what the future holds for us with COVID-19. Now, there are some researchers that are looking into developing a vaccine, but being that there's so much information that's still out there and that's needed, it's unknown of when a vaccine will be developed, if at all, for COVID-19. It would be great if there was a vaccine that was developed, because the vaccine helps us to make antibodies against a specific disease. In this case, it would be COVID-19, and then we would be able to, we would be protected from it. But there are many different phases of clinical trials that would be needed for vaccine development. The first stage would be to compare the vaccine to administer it to people that are healthy, and that those that are unhealthy, and see how it affects those. And then if it passes that stage, then it would test it on a lot more people that are actually infected with it, to see the outcomes of that. And there would be a few more different phases of the trial. So it could take a very long time, and we're not sure if the strain of this virus is mutating just yet. Drug development, there's been talks about using some antivirals that are currently FDA approved in treating COVID-19, and one of them is remdesivir. If a researcher, if we were to expect the FDA to come up with a new drug, it could take up to 10 years by the time that drug is developed and safely gone through all the clinical trialing before it hits the market. So that's why they want to potentially look at drugs that are currently on the market and approved for treating other conditions. Blood plasma. You may have heard that some hospitals and facilities, non-VA related, are accepting individuals who were infected with COVID-19 to give a blood plasma donation. And what they think this does is that individual who is infected has antibodies from being infected to COVID-19, and these antibodies may help another individual who becomes infected with fighting off the virus. So there's no data there yet to support how effective this is just yet, but there's been some anecdotal stories that some people have been sick fewer days with getting a blood plasma transfusion from an individual who was positive with COVID-19. This is something that our senior leadership at PVA is going to address with VHA leadership next week, to see if VA plans to begin accepting blood plasma donations and administering it to those that are infected. With states lifting stay-at-home orders, what should we do? How should we protect ourselves? Should we go about resuming our lives as normal as possible? It's not recommended to do that yet. You should still practice hand hygiene, social distancing as much as possible, and covering your face. If you don't have to be outside and around people, then don't. As far as protection, as I mentioned, adhere to safety guidelines. As Caitlin mentioned earlier, the CDC does not recommend masks for individuals who are unable to take their masks off. And unfortunately, that affects many of our PVA members, men and women. So our government relations team is working on this from an advocacy side so that airlines and business owners and restaurants will not that they will not allow those individuals to accept their business. So if an individual is a quadriplegic and cannot move his or her hands and is not wearing a face mask because they don't feel safe, that if something were to happen to them, they can't get the mask off in time or may not have someone to do that for them. Could that person still go in a restaurant and have their dinner? Could that person still get on the airplane? Right now, it looks like the answer is no in many of those cases. So our government relations team is just alerting the the CDC about this and other civil rights disability groups. A member from the CDC PPE task force, personal protective equipment task force, was notified about this from PVA this week, and they're going to look into it. So stay tuned with that. Next slide, please. And then we all have to deal with the backlog of appointments, healthcare appointments, nail salon appointments, haircut appointments, hair dyeing appointments. But it is concerning for many people that have had a healthcare appointment that has been put off for several months, and healthcare officials are tasked with determining who is more priority depending on what their other medical conditions are. A positive that's coming out of this is increased use of telemedicine. The VA, for the SCI system of care within the VA, spinal cord injury, has increased funding for telemedicine and telehealth, and they have greatly expanded telehealth capabilities over the last couple of months, and they're really trying to target individuals who are living in rural areas so that they can have access to care and not having to come into the hospital. And then also there's a greater appreciation for mental health. Many people were stigmatized for seeking mental health, and being that it's not a physical disease, we don't know who may have a medical health condition. Many of us do. And I think that now that people have been at home isolating and sheltering in place, they're experiencing some mental health concerns with isolation. And I think that more and more people are starting to have a greater appreciation of that and being more sensitive to those that have mental health conditions. And then a few resources that we recommend are always check the CDC website. They frequently update their information on a daily basis. The World Health Organization is also a good resource. The Department of Health in your local area is a good resource, being that different states have different guidelines for reopening. I highly recommend you check what your local area is doing and see what the restrictions are there. And then the VA has deployed a COVID coach app within the last month. And this app, you can use this to help with any kind of combat mental health issues, isolation, PTSD. It is on the VA website. We can take questions now if there are any.
Thank you, Amanda. So now, everyone, we can either use the Q&A box, or you can raise your hand using the raise your hand feature, and we will unmute you so that you can ask your question. All right, yes, Jean, I'll unmute you now. Okay, go ahead.
My question is, I have some of the symptoms, but I really haven't been out of the house. My husband goes out and does most of the stuff, picks up groceries and stuff. But my PCP had mentioned maybe I should get tested. My question is, I live 90 miles from my VA. Will community care cover that? For testing, or how do you go about doing it? And should I get
I would contact your VA and see where you are in network for your community care options near you, and go to a place that is in network, but call them in advance and let them know that you're having symptoms, and ask when they are doing testing and when you can come for that.
Okay, because they had suggested it. She said something about maybe I might want to, because there's some symptoms I have and some I don't. It doesn't seem like I've been running a fever, but then when you mentioned earlier, I'm a spinal cord injury and a spinal cord disease. I have the two things, and I'm service connected from. I'm 100% permanent total. So I was just wondering, what? Okay, great, thanks.
You're welcome.
All right, and now we have Ann Robinson. Go ahead.
Hi, guys. You made a good point because I was going to ask the question, because here in San Antonio, they're encouraging all businesses to not let folks in who are not wearing a mask. And that's something that I can't do. First to drive and then to do all the other stuff to even breathe. So my options are very limited. I can't go anyplace. So if you guys get that information, we would definitely like to have it here of what to do when you can't wear a mask, because I can't take it off or put it on myself. And
Right. There are, unfortunately, there are some different groups of people
close my screen.
that are affected by this. So once we get some information from our government relations team, we'll make sure that we send that out.
All right, does anybody else have any questions? Feel free to raise your hand or put it in the Q&A box.
I hope you all found this useful. We're very excited that PVA and our sports team, that Jen Purser has thought of this creative idea for us to engage with our female veterans. We will have more webinars, and I hope that many of you or all of you will attend them and let your friends know, and we'd love to have greater participation.
Yes, thank you. And this webinar was recorded, so you will be receiving an email so that you can view it again if you'd like. And please be sure to sign up for our future webinars. We will be having them bi-weekly at the same time, and we look forward to seeing you there. Thank you, everybody, and have a good day.
Bye.
Bye, everybody.